Unlock the secrets, learn new tactics, and build a winning strategy to win the aging game. Welcome to the Aging Game with Bruce and Susan.
Welcome to the Aging Game with Bruce and Susan. It's great to have everyone here. We have a great speaker today. It's going to be very entertaining and very educational. So welcome to episode 2 or season 2, episode 5. I'll get it straight someday.
Someday.
Decoding the Medicare Maze with Carolyn Marks of Logical Insurance Solutions. So welcome, Carolyn.
Thank you.
And we're going to dig into the whole Medicare and Medicaid maze in a few minutes. So great to have you here.
Thank you so much.
Yay. All right. Before we get started, so we had a couple questions from our last episode, which we had Lieutenant Sawyer here to talk about scams with seniors. I learned a lot of information. It was really good. So one of the questions we had was from Ralph in Naples, and he wants to know, what steps do senior communities take to keep seniors safe, as well as how do they vet their staff? So this seems like that's right up your alley.
So I get all the hard questions.
Yes, you do.
So thanks, Ralph, for that question. I appreciate it. And so, you know, your question is, it's an interesting one because every senior community is different. And, you know, there's not a standard across the board about how staff's vetted. And, you know, but the good ones, you know, do level 2 background checks on their staff. They do training on their staff. And so, you know, it's quite involved with some of the good communities, but again, it depends on the type of community. If you're looking at a, you know, independent senior community, it's probably not that, you know, strict or regulated. But if you look at a continuing care community or a nursing facility, much more regulation goes in place. But the good communities do a lot of training with their staff. They do a lot of vetting. They do background checks. And I would put that on your list of, you know, if this is important to you, put that on your list to inquire about when you visit the different communities, because it is across the board at all the different places.
All right. Well, I have another question, which came from Emma in St. James City, North Carolina, a little bit far away. She wanted to know, what advice do you have for talking with a senior who might be resistant, hesitant, or nervous to talk about scams?
So, Emma, that's a great question. And, you know, I hope you're safe in North Carolina. I know you're going through a lot there. So, you know, our hearts and prayers go to you there. You know, I would say first, you know, have them watch our podcast. You know, so we had the sheriff here last week, and he talked about scams, and, you know, but I would say encourage them to watch the podcast. But, you know, I think having an open conversation with a family member or with a friend, I think, is really important. You know, we all, unfortunately, we all get scammed, you know, and as we talked about last week, you know, you have people who are, you know, 18 hours a day in some foreign country, and they are focused on scamming people and fine tuning this scam. And so, you know, it's not something to be embarrassed about, because it happens. And, you know, it's just better to be prepared and have these conversations with your family members. If you think you're being scammed, or you have a friend or a family member that you think is being scammed, I think it's just good to have that conversation.
Yeah, it's nothing to be embarrassed about. I mean, I think every episode this season so far, I've said I was scammed about a raccoon. I want to adopt a raccoon. I love them. I don't know where this came from, but I got scammed. I mean, it happened, and I fell for every trick they say not to fall for. So it can happen to everyone, but you should talk about it so you're aware and not be embarrassed.
That's the advice.
Don't fall for raccoon scams.
That's right. Okay. Especially when they say go pick them up at the airport and give me $500 with a gift card.
Yeah, that's probably a little sketchy.
Yeah.
But I would do it. Okay. So I love stats. I love numbers. I'm such a nerd. So I have some today that are kind of relevant to our topic today. I wanted to share them with you to get your ideas, your thoughts. Are they crazy? Are they on point? What do you think? So the first one I have, it says 50.4% of beneficiaries are enrolled in Medicare Advantage, and the remaining 49.6% are enrolled in Original Medicare. Do you think that that's about it? It's a 50-50 split between traditional and Advantage?
I would say that folks who are on Medicare typically have something else to go with it. As you know, Medicare covers 80% of the expenses, whereas there's that 20% can be a big number. And Medicare Advantage plans are one way to cover that 20%. I'm not sure about the statistics. I haven't really looked that up. But basically, when it comes to picking a Medicare plan, you do have a choice between a Medicare supplement and a Medicare Advantage plan. And a good broker, preferably someone who represents more than one company, can sit down and kind of give you a Medicare 101 and explain the differences and then let them make an educated choice for themselves.
Sounds good. Interesting statistic.
Yeah. Then I have this, which it's a little old. So it says as of 2023, almost 66 million Americans were enrolled in Medicare, which means that roughly 25% of the 260 million adults in America have Medicare.
I think that's a good number.
Wow.
And certainly in Florida, we have an aging population, so that there are very many of us here in Florida who are on Medicare.
Then I had a fact which I thought was interesting. We talked about this last season. I want to say when we had Dr. Linden on about dental, because this kind of caught me on that. But it said Medicare doesn't cover dental, vision, or hearing. It says that like it doesn't cover dentals like cleanings, fillings, tooth extraction, dentures, dental plates, or other dental devices. It says Part A will pay for certain services when you get to the hospital, but it has to be like an emergency related to the procedure. I thought that was interesting. Like maybe that's a little outdated because there's so much preventative health with those three things.
Well, Medicare supplements and Medicare by itself do not cover dental, vision, and silver sneakers and other things. Some Medicare Advantage plans do cover those things, and it just varies according to the company. It varies according to your location because it does go by county. And if you have a Medicare supplement and you don't have the dental included, you can always get a standalone dental or vision plan. Many companies
Great.
offer that.
Interesting.
I read that it said when Medicare was created however many years ago that they didn't think that this was routine medicine, so they didn't include it. But nowadays they feel it is routine, but yet no one changes that policy.
Seems like the Wild West out there.
Yeah,
So
crazy.
Well, and I think folks are realizing that dental health affects physical health,
Mhm.
especially heart ailments. So it is integral to keeping folks healthy.
It is interesting information, I thought.
Thanks for those statistics.
Yeah,
Very
you know.
interesting. So let's take a break and hear from one of our sponsors.
When experience matters the most, Senior Housing Solutions uses over 30 years of industry knowledge to provide expert advice for those considering a move to a senior living community. We are the matchmakers of senior housing. Call today at 239-595-0207 for your free consultation.
Great to have you here, Carolyn. So can you tell us a little bit about who you are and your company and what you do? And I know we kind of threw you right into it, but if you just tell us a little background about who you are and what you do, it'd be great.
I'm originally a Minnesotan, and I've lived in the Chicago area and the Baltimore area, and now I'm here in Naples to stay. I love it here. And my first career was as a professional musician. I played the bassoon, and I worked extensively in metropolitan areas doing chamber music, educational concerts. I worked for many years with Baltimore Opera, and in Chicago, I was a member of the Chicago Chamber Orchestra. And so when I came to Naples, I knew I would have far fewer opportunities. And so I needed to find something else to do, and that became insurance. And I started with a couple of different companies, but was mentored by someone at Logical Insurance Solutions. Her name is Dee Merritt. And she started me off with one company, and then which was United Healthcare. And that happens to be the largest provider share in this area. And then branched out to Humana and some of the others, so that I have more tools in my toolbox.
Great. I did not know that. I know we've served on boards together, but I did not know the whole music background. So,
Yeah.
What's a bassoon?
Well, it's a woodwind instrument that is a double reed instrument. It's kind of the bass voice of the woodwind family.
I'm going to Google it. How do I
You
spell
have
it?
to Google it to see what
Hmm.
it is.
How do I spell it?
Bassoon, Bassoon.
Okay, I'm Googling it when this is done.
okay.
All right.
So great, Carolyn. It's great to have you
Awesome.
here.
Thank you.
Wonderful.
Yeah, thank you. So, first, before we really get into the hard stuff, I want to ask you a fun one. So, what is something that you know today that you wish you knew earlier in your career about this topic?
I really wish I had known more about insurance as my parents were aging. I really could have helped them a whole lot more. My mom did suffer from dementia and needed a facility for that. My dad was sharp right up until he lived till 98 and a half. But he did go into a retirement community, and I could have really helped them so much more if I had known more about Medicare and the insurance involved.
Great. You know, I gave a presentation this week, and I get this question all the time. And there's so much confusion between Medicare and Medicaid and how it, what pays for senior housing or assisted living or nursing care. So can you just break that down for everybody and just, let everybody understand what Medicare and the difference between Medicare and Medicaid and how it relates to senior housing?
Medicare and Medicaid are not the same. Medicare is something that you've paid into if you've worked 40 quarters. You have paid your Social Security, and that covers Part A. And so there's no charge for that. Medicare A includes everything with a roof over it. So hospital inpatient, skilled nursing and hospice, that type of thing. Part B, there's a charge for. Right now it's $174.70. And whether you're on Medicare or Medicaid, that will apply. Now, Medicaid is for folks who have fewer, less income and fewer assets. And so to apply for that, you go through a special process and you have to disclose what your net worth is. There are different levels of Medicaid, and it depends on how needy you are. And if you have certain chronic conditions, there can be more oversight of your plan and your needs, such as a care coordinator. So you would have to qualify for Medicare and then add on Medicaid.
So what about assisted living? Does Medicare pay at all for assisted living?
It does. What the requirement is generally 3 midnights in the hospital. So if you've had something like a knee replacement or a hip replacement, Medicare will cover that.
But assisted living is not rehabilitation.
Correct. You have to be getting better to stay in rehab. Long-term care insurance would cover assisted living and some of these retirement communities.
So I just want to make sure we're clear for our listeners. So if somebody moves into assisted living permanently, this is their permanent home in assisted living, and maybe they need a few, they need some assistance in the shower or they need some medication reminding. Can they use Medicare to pay for that type of housing?
In some instances, yes. A lot of folks really want to stay at home as long as possible, and they can access some of those services while staying in their home. If their needs are higher, then of course they would want to be in a living community.
Okay.
So, what's the eligibility for a senior to be on Medicare, Medicaid? You mentioned 40 quarters, so they have to have had to work 10 years?
Yes, 10 years. And although you can private pay, but it's expensive. I had neighbors from Germany, and they asked me to price it, and it was very expensive, so they opted not to use it. To qualify for Medicare, you need to be 65 or above, under 65 with disability. Typically, disability is something like chronic or end-stage renal failure or ALS, and typically the wait is 24 months to get qualified as a disabled person. They have to collect Social Security for that length of time. However, some conditions, and I've run into this, you can get that disability covered quicker than 24 months.
So I see a lot of advertisements about attorneys doing Medicaid planning. What are your thoughts on that?
There are some very good sources out there for that. And some people do need legal assistance to figure that out. And I'm not going to recommend anybody specifically, but that can be an important tool in picking your care going forward.
So if somebody goes through this whole Medicaid planning and diverts all their assets to wherever they put them, can they now go into a Medicaid facility?
Yes. Typically, you would need to make the requirements for Medicaid, and then you would be able to go into an assisted living. There is a long list of things that you have to qualify for, and that's why legal representation or an expert in that field would be certainly the one to speak with.
So if I hired a lawyer and I was doing this, is that a guarantee that you're going to get approved? And then what happens if I'm doing the planning now? I assume it's because I don't need it now. Maybe I do. Then what happens in a year or 3 years when you need it? Where are you going? Because I don't think there's a lot of these types of communities around here. Correct?
That's true. There are not a lot of beds for Medicaid patients in this area.
So is that told up front? Because I would hate to go through that type of planning.
It is not.
Yeah, that would be my concern. Like, because I mean, I get calls all the time asking about Medicaid, and I'm like, yo, there's nothing here. Not in terms of home care agencies.
It is, and I think it's a big issue because people think that they can get all this Medicaid planning. They pay an attorney to do all this, and then they wave the white flag saying, "I have Medicaid, let me in," and there's not beds available.
That's true.
And so there are many times when I get calls and people, we have to look outside of Southwest Florida, and because there's nothing in this area.
Is a Medicaid facility or community like going to I hate to pick a name, but since we had Bill, like the Carlisle's beautiful. That's a resort living, beautiful thing. Do they have like a number designated to Medicaid?
They do not.
So is a Medicaid community like one of those more sad ones where you see?
So unfortunately, that many of the Medicaid facilities, and we're really talking more nursing facilities, not assisted living. It's more more nursing,
right?
And because they don't have a lot of money coming in, you're not talking about the upper echelon of facilities, and so the quality of the facility, the quality of the care, the safety, all those things, may not be there, and so for someone to say I need a Medicaid bed, and we send them over to Dade County over in Miami, who knows what's going to be over there.
That's tough,
right?
That's true, and it's typical that there is a shortage of help in a lot of those facilities. High turnover and wages not what folks are looking for, so it can be understaffed in some cases, which is something to watch out for.
Which is, you think about, our government, this is a government program,
Mm-hmm.
and you would hope that the government would put some funds into this program to make it a quality, but
True.
it's just, it's low on the totem pole.
It is.
So for some people, it's probably like the only option if finances are a problem and assets are a problem. But people that are, maybe on that borderline, it seems like maybe they should really understand this before they go down that road.
They should. And there's times where people have to, They have to be in a shared room. So you're going to have a roommate, because you're not going to, you're not going to get the private room with
Yeah.
with all the bells and whistles. You're going to be probably in a shared room with somebody that, is needs to be there because of financial reasons.
Mhm.
Nobody would want to be my roommate. It would be an not ideal situation for them.
And all the raccoons.
Yeah, well, it'd be my raccoons, my dogs, the rabbits I find. I don't know, everything. So can you break it down like kind of simply for us? Like, what are the main differences between like traditional Medicare and Advantage? Like, what do they do?
Again, traditional Medicare only covers 80%.
Okay.
Medicare Advantage plans are federally funded, and typically the programs, whatever they offer for a given year, only last for that year. So this is coming up to the time when we can make changes. Folks are getting something in the mail or email called the annual notice of change to show them what their plan will look like in 2025. And so this is the time to attend a seminar or look online or go to Medicare.gov and try to look at the different possibilities out there.
And so you should start at 62, 65 to start investigating all this.
Well, it depends because some people are working longer. And if they have adequate employer coverage that is at least as good as Medicare or better, they can stay on an employer plan until they leave their job.
Oh.
So it would be good to sit down with a broker a year, I would say a year, maybe 6 months in advance of either leaving the employment or turning 65.
And I know that this is what you do. Can people just go out on their own to do this or go on the internet to do this? Or
I don't recommend that because, first of all, when folks are turning 65, they get a boatload of mail about this plan and that plan. And if you go online, you're going to get a million phone calls. And it's hard to sort through all of that there's no Medicare 101 out there. And so folks would be better off consulting a broker who can guide them through the process and answer their individual questions because not everybody's needs are the same.
What do you think are the most common challenges that people face navigating Medicare?
I think not understanding how it works. With Medicare Advantage plans, you have either a PPO, which is a preferred provider organization, or an HMO, which is a health maintenance organization. The difference between the two is with a PPO, you have in and out of network coverage. However, you will pay more out of network. So the cheapest thing is to stay in network. And for that reason, you need someone who can check your doctors and your specialists to see if they are in your network. HMOs are changing just a little bit right now, and some of them are being called HMO point of service. So that gives you a few more options than it used to be. It used to be that you had, with an HMO, in-network only coverage.
so I want to kind of go back to just traditional Medicare. So if can you just talk about, if somebody is going to a rehab and they have Medicare, so what does Medicare cover for rehab?
A certain number of days
20 days?
are provided, and it comes out to different levels of funding. So the first few days is one rate, and then thereafter there's another rate, a higher rate. And after that, you might be on the hook for the full amount.
So my understanding is that the first 20 days are included, and
With
then
original, yes.
with traditional original Medicare, and
Mhm.
then days 21 through 100, the individual is responsible for about $200 a day of care.
Yes.
And is it true that at any point during that time frame from day 1 to day 100, that if somebody plateaus or stays the same, that Medicare stops?
That's true.
So if
You have to be getting better.
so what we would call a plateau is
Yes.
so if somebody's in a rehab facility and they are bedridden and they're not getting out of bed and they're not going to physical therapy and they're not doing anything, then Medicare could stop.
It could stop.
So
A
they
lot of people
cover.
don't know that.
No, right, they don't. So they're covering 20 days. Then from 21 to 100, I'm on the hook. If I'm not better by day 100, I'm out.
You're a private
benefits.
pay.
Yeah.
Oh, so from 21 to 200, I'm just paying a portion, the $200, and they're covering whatever the rest is. And then
Basi-
what happens at day 101? It's all private pay.
You're up to about $500 a day.
Ouch. I'll be working till I'm 100 if I live that long.
So, and a lot of people don't know that. They
That's
just
true.
think they have
Yeah.
Medicare and they, and it's unfortunate because they go into a rehab and, I tell people like, hey, you better, this is the carrot that you need to go to physical therapy. You need to be doing, all the things that they're telling you to do to get better, because if you're not showing signs of getting any better, then forget about it.
That's true. And Medicare is not long-term care. So if you hit that plateau, you will not have long-term care.
Wow. So
So-
this makes me think of two other things that are completely not on our list today. So going to Medicare Advantage, I get a lot of calls about the home care benefit. And however that's advertised or shared with them, they think that it's a lot more comprehensive than what I understand it to be. So can you talk a little bit about that, or what questions should our listeners be asking when they're exploring that part of that benefit?
Well, it varies from company to company, and a company like United Healthcare offers more than one possibility for Medicare Advantage plans. So folks should look into that and compare benefits between different companies and between a company's different plans to find out what's available for them. So the rates vary, and it would be good to know that in advance. Surprises in healthcare insurance are really not usually good ones. So forewarned is foreprepared.
That's good to know. And so with the Medicare Advantage, besides age being, so you have to be a certain age, are there other requirements?
No, just that you've paid in 40 quarters, so you can private pay. And I would warn folks that if they go for a period of time after they've been entitled to Medicare and don't pick up Medicare Part B or a drug plan, they can incur penalties. Also, if depending on income limits, if they are more wealthy than the average person, they probably will have a larger share to pay.
So
No, I want
there's so much confusion out there between Medicare A, Medicare B, Medicare C. What is it? It goes D, E,
I know there's
F,
a
and
G.
G. There's a G.
I saw a G the other day.
The supplements have letters assigned to them A through N. Right now, the richest plan people can get is a Plan G. It's the most comprehensive. There are other choices out there, but again, people should educate themselves as to what is covered and what is not.
I know D is drugs, so
D is drugs. A and B would be original Medicare. C refers to a Medicare Advantage plan. Medicare Advantage plans usually include the drug benefit. However, if they're on a supplement, they have to get a standalone Part D drugs. And that is even true for folks that don't take any medications. It's a requirement to have drug coverage, whether you need it or not.
What's E and F?
Pardon?
What's E and F?
E and
Well, we know
Those
G. We got to G, but we skipped
those
E and
are the
F.
supplements. That's
Oh.
just the supplements.
Just randomness.
and is it by state or is it national?
Medicare supplements are regulated nationally. And so one company's Plan G is the same as another company's Plan G. Medicare Advantage plans vary not only by state, but by county. And so people need to be aware of that. If folks are going to travel a lot, different Advantage plans offer different out-of-state benefits. And so if the grandkids are in the Midwest and you're in Florida, that's something you would want to consider.
And with the Advantage plan, does that pick up any more of the nursing care, or it's basically the same as the traditional?
No, it covers skilled nursing.
For 100%, or?
No, not 100%. You're paying a portion.
Okay. And the same kind of things, you have to be showing signs of getting better?
Yes.
Okay.
So, have you heard of the guide program?
No.
Really? So, we had Dr. Perry on last season to talk about Medicare launched a pilot program July 1st of this year for those that are living with Alzheimer's and dementia. And as long as they have Medicare A and B, they cannot be enrolled in Advantage. They can't be in a PACE program or live in a skilled nursing facility. Medicare is now covering for them to have a care navigator assigned to them to help navigate their health journey and their aging journey. And then if they have a caregiver as defined by Medicare standards, so a unpaid family or friend that's helping them with ADLs or IADLs, then they're giving them an allotment of respite hours per year. And the program is officially being launched July 1st of 2025, but they gave us this year, July 1st, 2024, if we wanted to enroll in it early. So I'm actually the only active participant in that in Southwest Florida. But it's interesting as we're working with people that are in Medicare. To me, I guess I would think that you would know if you have traditional or Advantage, assuming that one is requiring you to enroll in it. But as we're working with a lot of these people, and most of them are not clients of Bright Star, so we're getting them from the community, different resources and stuff. But we submit everything to Medicare, it comes back, and I've had a handful come back and decline because they're in Advantage. And then when I go back and I talk to the people, they're like, no, I had no clue. And I'm like, how is that? Is that like an adult child is enrolling them and uninformed and not sharing it? Or
it could
do you
be.
have any?
Plus, there are memory issues as we age, and we've run into that. I don't specifically know about that program, but I have heard talks by folks in the area, in fact, one that's new to the area, that is assisting folks in finding, for example, respite care for the caregivers, which is very important, and other aids to folks who are suffering memory issues.
Oh.
So these are coming on board, and I hope in the future we'll have much more of that.
I think this program is going to be a really big game changer. Next year, Medicare is going to send out letters to everybody that's eligible. But right now, as we're trying to get it out, I mean, definitely respite care for the caregiver is so important. We're seeing the caregiver, decline at a faster rate than the person who's actually, living with an Alzheimer's or dementia. So it is really important. But just navigating these conversations, because in my business, traditionally, I'm not dealing with people that have Medicare. So we're private pay, long-term insurance, regular health insurance. So this has been an interesting few months for me navigating these conversations with people and just seeing that, yeah, you can tell when they're dealing with memory issues or they just flat out, don't understand. So if you had Advantage, could you not have that and go back to traditional Medicare? Can you?
You can do that.
Oh, you can? Mm-hmm. Oh, good. Everybody go back.
Yes, and there are certain instances when that might be to a person's advantage. I like to use the example of excess fees. And just for real easy, simple math, say a individual needs open heart surgery, and let's call that a $100,000 expense. Medicare will pay the $100,000. However, some of the physicians and anesthesiologists may say, we can't cover our malpractice insurance at $100,000. We want to charge $150,000. Medicare then comes back and says, we will cover 20% over. So that leaves a $30,000 balance. And you could have that exposure if you only had Medicare by itself.
Interesting. It's a good example.
Yeah.
Kind of switching gears, can we talk about the Medicaid waiver program?
Oh, yeah, let's. I have so many questions.
Medicaid waiver?
Yes.
I don't think I can speak to that.
Okay.
There's not a lot in the area that do it.
So the Medicaid waiver program is a program for people who are in assisted living, and it pays a portion towards care-related charges in assisted living, but you got to be paying privately in assisted living. You have to go on a waiting list, which is about 2 years long to get to apply, and there's no guarantee that you're going to get accepted. So it is it's out there, but again, it's only meant to pay for care related charges, not room and board. So if you're in assisted living and you're paying $4,000, and that's your room and board, and then you're paying for care on top of that, let's just say it's $2,000, the Medicaid waiver is only going to be paying for that $2,000, not the $4,000.
Wow.
So
Interesting.
Yep.
Are there any changes or updates coming that our listeners should be aware of or looking for or research?
Definitely. This year there will be a lot of changes. The Inflation Reduction Act has gone through. One of the biggest advantages to folks who have a lot of pharmaceutical expenses is that the so-called donut hole or coverage gap has gone away. This means that people would go from the initial coverage stage to a medium coverage and then skip the donut hole coverage gap and go straight to catastrophic coverage. And in 2025, that means that the most you can pay for your pharmaceuticals, your out-of-pocket plus what the insurance pays, is going to be $2,000. That is a huge help for people. I have folks on 15 different medications. Another thing that it's done is allowed Congress to negotiate some pharmaceutical prices downward. Eliquis, for example, is taken by a lot of folks, and that was extremely expensive for folks. So that is one drug that is going to see some reductions. There are others and more in the coming years. I like to help people find the cheapest way to get their needed medications. And there are some discount programs through pharmaceutical companies. Again, you have to qualify financially for some of those. There are some Canadian pharmacies that folks are using that are also very good. I recently just heard of one called Maple Leaf Pharmacies out of Canada. And one of my clients is getting Eliquis for $50 a month.
Wow.
So that's a huge savings.
Wow. So Carolyn, you're a wealth of knowledge and you're a great resource and a good friend. And I know we were talking earlier that part of what you do is you visit people in their own homes and you like to go where people are and kind of let them tell you about all their medicines and have that conversation. So how can people reach you and contact you and to learn more?
They can go and access Logical Insurance Solutions, or my email address is Carolyn, Carolyn, at logicalinsurance.com. And I would be happy to speak with folks. Typically what I do is spend about an hour with people who are coming up to make their decisions on Medicare and explain fully, answer all their questions. Family members can be present. It's important to have a really exact read on what their prescriptions are, the dosage, the milligrams, where they like to fill their prescriptions, because we have preferred and non-preferred pharmacies. And so I like to take that time to be able to give them the guidance that really can send them off with some good tools going forward.
Great.
So is there Anything that you would like to share on the topic of Medicare, Medicaid that you think we haven't touched on today that our listeners should know?
One thing that I would like to present to folks is that if you're getting cold calls from people who want to sell you Medicare, I would say ask for their national producer number. That is our license number. A lot of the folks calling are not licensed, they're marketers. And my guidance for those folks who are sick and tired of getting a lot of phone calls is to ask for that. And if they can't provide it, say you're going to report them to Medicare. The calls should stop.
Great.
Sounds like a good piece of advice for our scam episode.
I would say that's a good way to prevent a scam.
Yeah, way to follow up our last episode. I like it.
And Logical Insurance, do you all sell other types of insurance?
Yes, we can sell under 65, even travel insurance. Medicare does have some travel insurance benefits depending on if you have a supplement or not. However, those can be difficult to access if you're overseas. I know of a elderly woman who went to Italy, had a stroke, and needed to have medical coverage coming home to the United States. So we partner with the International Medical Group to provide those services. I'm losing my train of thought.
So we had an earlier episode, and we were talking about retiring and living on a cruise ship, and I think Susan's all over this about retiring and your later years living on a cruise ship, and we talked about the good and bad of that, and the bad would be if you needed medical care, what are you going to do?
Well, cruise ships are limited.
Yeah.
Due to the expense of some facilities, I've heard of people taking a year-long cruise. However, cruise ships are not equipped to handle emergencies, and in the sense that they don't have CT scans and specialized medicine. They can treat you on the ship, but then they're going to get you off.
Mm-hmm.
See, Susan? See?
Yeah, I know. But I mean, honestly, like if I have a stroke, I'm just going to go overboard and be with the fish anyways. So let a shark eat me and I'd die my best life. But I could live on a cruise ship. They're going to make my bed every day. I'm going to have a towel animal. Whatever food I want to eat. Drinks unlimited. You want to go to the pool? Go to the pool. You want to see a show? See a show. I think it's ideal at a certain age, but then you need to be on land after a certain age. But I'm going to have to work till I'm 100 anyways, so this is just a pipe dream.
It's attractive to a lot of folks who wouldn't want everything taken care of for them.
Super Mario does. He lives on Royal Caribbean. He's lived on there for like 15 years. Every ship has like a plaque for him. So I guess I want to be...
I don't know who that is.
He's just some guy. I think his name is actually Mario. They call him Super Mario. He's a plaque on everything. And lives on all these ships. He sets up shop, does his work. But then during the pandemic, he had to get off and he lived in Barbados, which was...
There's always that.
I thought wasn't a bad gig either. But yes, I would love towel animals. I'd love my bed made, all of that. But health-wise, especially me, I have Crohn's, probably not ideal. I need that CAT scan machine.
So Carolyn, tell us your website again, just so we have that.
Well, it would be www.logicalinsurance.com.
And your office is in Lee County in Fort Myers, but you visit people in their own homes and they schedule.
I will go to homes.
And you also do a lot of presentations.
Yes, I'm doing 13 Medicare presentations this fall.
Wow. Where do you do those at? Where can we see you?
I'm going to be at the Perkins near Livingston and Pine Ridge.
Right down the road? Yeah.
Yeah.
Because this is Pine Ridge?
Yeah.
Wow. All right. For all of them? All 13?
Yes.
All right. I'm going to find you there.
Okay. You're welcome.
I like their pie.
So great. Thank you, Carolyn. And
thank you.
Let's take another quick break for our sponsors.
At Via Image Productions, we know that every story has its own rhythm, a unique look, and moments worth capturing. From photography that freezes time to cinematography that brings those moments to life, we don't just shoot, we create. Our passion for storytelling and attention to detail mean that each project, big or small, gets the same dedication, the same creativity, and the same V-Image touch. Whether it's a corporate event, social media content, or a promotional campaign, we're here to help you tell your story your way. V-Image Productions. Your image is our focus. Call today for more information at 239-287-5577.
We just had a great presentation with Carolyn Marks from Logical Insurance Solutions. Very informative. I think she helped simplify a very confusing topic that's out there. Maybe raised more questions than you people thought, but it's an important topic, and it's important to do your research and to understand this way before you get that certain age. And so reach out to Carolyn and let her share her wisdom with you. So it's great to have her here.
Definitely. Way to take a topic that can be slightly boring, Medicare, Medicaid, and make it really exciting and all stuff for us to learn. Next week, I'm pretty excited. We have Dr. Sorensen. So we're going to talk about immune health, which is obviously something I need to pay attention to, and unleashing the power of alternative therapies. So another one of your wonderful connections that we're going to meet.
So as we prepare for next week's episode, I want our listeners to think about, what are you doing to stay healthy? What are you doing to improve your immune system? What are you doing to, how much water do you drink a day? And so,
None.
Think about what you are doing to stay healthy and to get healthier in the future.
Yeah, drink water. So I brought my water in my Encompass Health cup because I'm promoting Carrie and Encompass today because I want her to join us in season 3, hopefully. But yes, you should drink water. I don't drink it enough. I get yelled at all the time. So I'm drinking water, making everyone proud today.
So great, everybody. Great episode. Thank
Yes,
you. Thank you,
thank you.
Susan.
Thank you very
Thank
much.
you, Carolyn.
Really appreciate it.
Be sure to subscribe to our podcast and follow us on social media. You can also find more information and resources at www.theaginggamepodcast.com.